cancer often develops quietly, without obvious signs or symptoms, making it especially dangerous. Many people may not realize anything is wrong until the disease has already progressed, which is why it's sometimes called a silent threat. Despite advances in medicine, it remains the second leading cause of cancer deaths in the UK, affecting thousands of families every year and placing a heavy burden on the healthcare system. For those diagnosed, it marks the beginning of a challenging journey, one filled with uncertainty, difficult treatments, and emotional ups and downs. The support of loved ones becomes more important than ever during this time. Early detection is absolutely crucial. When bowel cancer is caught in its earlier stages, treatments like surgery and chemotherapy can be highly effective, often leading to much better outcomes, and even full recovery for some patients. The real danger comes when cancer spreads, or metastasizes, to other parts of the body. At this stage, what began as a localized problem can quickly become a life-threatening crisis, making treatment much more complex and challenging. For years, scientists have worked tirelessly to understand why some bowel cancers spread so aggressively, searching for clues in the hope of finding new ways to stop it. Now, a remarkable breakthrough has revealed that bowel cancer cells can completely change their identity. These cells are able to transform into different cell types, making them stronger, more adaptable, and more resistant to treatment than previously thought. This discovery could fundamentally reshape how we approach treatment, opening the door to new therapies and offering renewed hope to patients and their families who are facing this disease. Understanding this shape-shifting ability is a pivotal moment in the fight against bowel cancer, bringing us one step closer to more effective treatments and ultimately saving more lives. Imagine a spy who can change their entire biology to blend in, adapting their appearance, behavior, and even their very identity to avoid detection. This is not just the stuff of thrilling movies or secret agents. It's exactly what some of the most aggressive bowel cancer cells are capable of doing inside the human body. These cancer cells are masters of disguise, able to transform themselves in ways that make them almost unrecognizable to the body's natural defenses, and even to doctors searching for them. At the Cancer Research UK Scotland Centre and the University of Edinburgh, scientists have witnessed these cells shape-shifting, adopting the characteristics of skin or muscle cells, and sometimes even mimicking other cell types entirely. This isn't just a minor tweak, it's a total reinvention at the cellular level, allowing the cancer to become tougher, more elusive, and far more adaptable than previously thought. Dr. Patrizia Cammareri describes it as a cancer cell putting on a suit of armor. By becoming skin-like, it shields itself from threats, making it more resilient as it travels through the body and invades new tissues. This remarkable ability, known as cellular plasticity, is something we usually associate with stem cells, which can become many different cell types. But seeing this level of plasticity in cancer cells is both surprising and deeply concerning. It means cancer isn't a static enemy. It's dynamic, constantly evolving, and always finding new ways to outsmart treatments and the immune system. By borrowing survival mechanisms from other cell types, cancer cells become more formidable, able to resist therapies and survive in hostile environments. This shape-shifting is not a random accident. It's a calculated, strategic move that helps cancer survive, spread, and ultimately thrive where it shouldn't. It's a key weapon in cancer's arsenal, allowing it to metastasize and establish itself in new environments throughout the body, making treatment much more challenging. But by understanding this incredible disguise, researchers are uncovering new ways to target and disrupt cancer's strategies, offering hope for more effective treatments in the fight against metastatic cancer. Cellular plasticity is the ability of a cell to change its identity and function. Normally, mature cells lose this flexibility, but aggressive cancer cells can reactivate it, reverting to a more primitive, adaptable state. This lets them shed their original features and take on new ones, like those of skin or muscle cells. Such changes help cancer cells survive the journey through the bloodstream and colonize new organs. The research, published in Nature, calls this a loss of colonic fidelity, cancer cells betraying their origins to become more dangerous. By understanding this plasticity, we can start predicting and preventing cancer's next move. It's a shift from just treating visible tumors to blocking the cancer's escape routes. This insight could be key to stopping metastasis before it starts. Metastasis is the deadliest aspect of cancer. 90% of cancer deaths are due to its spread, not the original tumor. When cancer cells break away from their starting point and travel to distant organs, they become far more dangerous and difficult to control. This process is what makes cancer so life-threatening, and why early detection and treatment are so critical. Surgery can often remove a primary bowel tumor, giving patients hope for a cure. But once cancer spreads to vital organs like the liver or lungs, it becomes much harder to treat and the chances of survival drop dramatically. At this stage, even the most advanced treatments may struggle to keep the disease in check. Scientists have discovered that shapeshifting is a key reason why cancer cells survive this perilous journey. Unlike normal cells, cancer cells can change their identity, allowing them to adapt to new environments and evade the body's natural defenses. A colon cancer cell must break away from its original tumor, survive the hostile bloodstream, where immune cells and physical forces threaten to destroy it, and then invade a completely new organ. Each step is a major challenge, but shapeshifting gives cancer cells the flexibility to overcome these obstacles. By transforming into tougher, skin-like or muscle-like cells, cancer adapts to new environments and resists attack. This ability to mimic other cell types helps cancer hide from the immune system and survive treatments that would otherwise destroy it. This remarkable adaptability lets cancer not just survive but thrive and build new tumors in distant organs. It's like a master of disguise, always finding new ways to outsmart the body's defenses and medical interventions. The most aggressive cancers are those that master this art of disguise. These are the cancers that spread quickly, resist treatment, and are the hardest to defeat. For oncologists, this means treatments must do more than just kill cancer cells. They must also block this transformation process. Stopping cancer from changing its identity could make it much more vulnerable to existing therapies. If we can prevent cancer from shapeshifting, we can keep it exposed to the immune system and to drugs designed to target its original form. This could make treatments more effective and give patients a better chance at survival. This new understanding could help trap cancer before it spreads, opening the door to innovative therapies that target the root of metastasis. It's a game changer for how we approach advanced bowel cancer, offering hope to patients and families facing this devastating disease. Stopping the shapeshift could be the key to saving lives, transforming the future of cancer care for millions around the world. At the heart of this discovery is the ATRX gene, a crucial genetic switch. Researchers found that losing the ATRX gene triggers bowel cancer cells to shapeshift and spread. ATRX acts as a guardian of our DNA, keeping the cell's genetic instructions organized. When ATRX is lost, genetic chaos allows cancer cells to access ancient programs that enable plasticity. This opens the door for cancer to reinvent itself and become more aggressive. The loss of ATRX can now serve as a biomarker, helping doctors identify which patients are at highest risk of metastasis. Testing for ATRX could allow for more personalized, aggressive treatment plans. This moves us closer to truly personalized medicine, treatments tailored to each tumor's genetic makeup. Targeting ATRX loss could be a turning point in stopping cancer's spread. This breakthrough comes as bowel cancer rates rise alarmingly among young adults. Once considered a disease of older people, it's now increasingly diagnosed in those in their 20s, 30s and 40s. Studies show early onset bowel cancer is rising in over half of countries worldwide, including the UK. Young patients often face delayed diagnosis, as symptoms are mistaken for less serious conditions. By the time cancer is found, it's often advanced and harder to treat. The new research into shapeshifting and ATRX is especially relevant for these aggressive, fast-spreading cases. It highlights the urgent need for awareness and early detection at any age. Recognizing symptoms early could save lives, regardless of age. Bowel cancer claims nearly 17,000 lives each year in the UK, making it the second leading cause of cancer death. In Scotland alone, about 4,000 are diagnosed and 1,700 die annually. Early diagnosis is critical. If caught at stage 1, survival rates are over 90%. But if found after it spreads, survival drops below 15%. This stark difference shows why stopping metastasis is everything. The new discovery about cancer's shapeshifting targets the heart of the problem, its ability to spread. By understanding and blocking this process, we can develop better strategies to prevent advanced disease. The research provides a clear focus for future efforts. Stop cancer before it spreads. This shift from reactive treatment to proactive prevention could dramatically improve survival rates. It's a vital step in turning the tide against bowel cancer. Scientific breakthroughs matter most when they lead to real benefits for patients. The discovery of ATRX's role in cancer shapeshifting offers a clear target for new therapies. Testing tumors for ATRX loss could soon become standard, helping doctors tailor treatment plans. Patients with ATRX loss could receive more aggressive, proactive care from the start. The ultimate goal is to develop drugs that block the shapeshifting process or restore ATRX function. Preventing cancer cells from changing identity could make them more vulnerable to chemotherapy. This 1-2 punch, blocking disguise, then attacking, could offer new hope for advanced cases. The path from lab to clinic is long, but this research brings us closer to personalized, effective treatments. Every new discovery chips away at cancer's mystery and fear. The revelation of cancer's shapeshifting is a major breakthrough, offering hope and a new path forward. It explains how cancer spreads and gives us new tools to fight it. Sustained investment in research, like that at the Cancer Research UK Scotland Centre, is crucial. For patients and families, this means science is moving relentlessly toward better outcomes. The future could bring treatments that prevent spread and tests that predict cancer's behaviour. We're moving toward truly personalised care, where each patient's cancer is treated uniquely. This insight into cancer's secret life as a shapeshifter brings hope for a future where we can finally conquer this disease.